Today we're here with Dr. Chris Hammond, neurologist and sleep expert at Ogden Clinic, to ask him how this COVID-19 pandemic affects our sleep and what we can do to sort of maximize our sleep each night. So Dr. Hammond, how do stress and anxiety affect our sleep?
Sure, thanks Tim. Thanks for having me. Yeah, there are several factors that influence sleep, and certainly we look at factors that help us get to sleep, we call sleep onset, in addition to help maintain sleep. And no doubt, Tim, certainly what we're going through with the pandemic, we're experiencing all sorts of stressors, and that's job-related, finance, children now being homeschooled, and these are considerable stressors. If anything, what we need during, even in the pandemic, in addition to the rest of our lives outside the pandemic, is some consistency. We can talk about certainly sleep hygiene principles that help us maintain sleep, in addition to circadian rhythms. One of the problems that we're suffering now as we've gotten out of our regular cycles is that circadian influences are a significant impact in how we sleep and how we can maintain wakefulness. When we're out of that regular schedule of things, we tend to get to bed later perhaps, or get up later, and that disrupts that circadian function certainly. But more importantly, I think at this point in time we're dealing with obvious stressors, anxieties, and factors that's influencing, inhibiting our sleep.
There's been talk on social media and other places during this COVID experience, adults even have been having more nightmares. Are nightmares associated with stress, or is there a correlation?
Well, there is a correlation. Dr. Cartwright out of Rush in Chicago, she's done a lot of research with nightmares, and that associated with mental health disorders, especially major depression. And certainly it seems there is a good correlation with depression and nightmare, and sometimes what we call nightmare disorder. We can see that after PTSD and other factors, of course. But yes, certainly I do believe that stress will trigger bad dreams. Nightmares can be a very subjective sense, but quite often I do believe in dreams in general, including so-called nightmares, is a process, kind of a mental process during sleep, maybe working out the day's events, thoughts, and so forth. And obviously that process can be frightening for people. And really comes down to problem solving. Dealing with dreams and nightmares in general. And so when we're stressed, when we're in a situation, we have difficulties with problem solving, of course, just in the daytime. That can manifest itself at night. And so yes, I do believe we're going to see more of these bad dreams during stressful times, no doubt about it.
In what way does sleep or lack thereof affect our immune system?
That's a very good question. That's been under research for a couple of decades now. We've seen this from studies looking at sleep deprivation in general, in addition to factors that could lead to sleep deprivation or poor quality sleep, including sleep apnea. And we have an abundance of data with sleep apnea specifically, but also just linked to anything that disturbs sleep or causes sleep deprivation. And we see factors involving the immune system. For example, these interleukins and cytokines are responsible for regulation of the immune system and a strong defense. That can be impacted. We actually have very specific markers we can test and look for these immunal changes. And yes, it's implied certainly that's going to compromise our response to infectious diseases.
At what point would you recommend someone schedule an appointment with the Ogden Clinic Sleep Center?
Oh, good question. Now, insomnia is so common, Tim, and we can look at those provocative factors. Absolutely, we should do that. And let's see what we can do to improve our sleep hygiene. And that includes everything from consistencies at getting to bed to getting up in the morning, making sure we have a conducive, calm environment. It's conducive for sleep, good temperature, it's quiet, dark, and so forth. In addition to, one thing I like to call is stimulation control. And that just means we eliminate anything that could be stimulating in our bedroom. Yeah. Monitors, television, smartphones. We don't want exposure to that light several minutes before we go to bed. Even if it's an hour or two before. We need to reduce the light intensity in general and reduce the physical intensity. Sometimes a calming warm bath can help with that. Beyond that, when we've taken that initiative and looked at all those factors and maybe review your medications, review your caffeine consumption in the daytime, and is there anything else going on? And then maybe consult with either your primary physician and then ultimately a sleep physician if necessary. Because there can be issues at night, for example, obstructive sleep apnea is an under-recognized problem inducing insomnia. And we've had the good fortune of identifying significant degrees of sleep apnea in these chronic insomniacs. And whereupon treating their sleep apnea, their insomnia is also treated at the same time. And it could be restless legs issues, it could be movement disorders at night, and many other issues that can be addressed in the sleep lab with a sleep physician.
Thanks again, Dr. Hammond. For more information about Dr. Hammond, our neurologist, and our sleep center, please visit us at ogdenclinic.com.